Hello, everyone. Thank you so much for joining us for this month's Food Insecurity Learning Cohort on Funding and Sustainability. Before we kick this off, I'm going to pass it over to Alex Lewin-Zerdling and our esteemed panelists for today's discussion. I just want to give a big thank you to all of you attendees listening in live or the recorded session that's going to be on our Forum B website later this week. This is our final webinar of our Learning Cohort series made possible through a grant from Robert Wood Johnson Foundation. We've seen tremendous success in this Learning Cohort, and we just want to thank you all for participating in this collaborative learning network here through the discussions that we've been having on these webinars, as well as our discussion forum on Forum B. So thank you so much for participating and engaging in these really crucial discussions on how to best address food insecurity in your communities through these topics of data and evaluation, funding and sustainability, building C-suite buy-in, etc. So thank you so much. And with that, I want to pass it over to Alex Lewin-Zerdling.
Perfect. Thank you so much, Monique. And as Monique mentioned, it's really hard to believe that this is the last food insecurity webinar of the Learning Cohort series. In case this is the first webinar that you're attending, my name is Alex Lewin-Zerdling, and I've been a consultant working with Root Cause on these learning cohorts, and I'm thrilled to introduce today's webinar. Following today's presentation, we'll also continue the conversation via Forum B, the online platform that Root Cause has been using to share thoughts, perspectives, and resources with each other. So if you need any help logging into the Forum B site, don't hesitate to reach out to myself or any of the Root Cause staff. Just a few quick housekeeping notes. Today's speakers will present for about the first 45 minutes, and then we'll leave about 15 minutes for Q&A. If you have a question, please enter it into the question box within the GoToWebinar platform, as you'll all be muted throughout the presentation. So I can field questions as they come in at the end of the presentations. Additionally, our speakers may use the chat function in the GoTo platform. So if you have a comment or response when the chat function is used, please add your thoughts in that chat box. Following today's presentation, you'll receive an email from Root Cause with a link to a short survey to provide your feedback. I just wanted to say thanks in advance for taking a few minutes to complete that. And as always, we encourage you to be an active participant on the Forum B site. Today's webinar will also be recorded and posted on the Forum site within the week. So with that, I would like to introduce our fabulous speakers for today. Kimberly Libman is Vice President of Policy at ChangeLab Solutions, where she oversees the organization's policy strategy and food systems portfolio. Before joining ChangeLab, she worked at the New York Academy of Medicine as Director for Prevention and Community Development. As a researcher and advocate, she has worked at the intersection of public policy and health for over a decade. Her work on chronic disease prevention spans local, state, national, and international levels. And our second speaker today is Katie Garfield. Katie is a clinical instructor at the Center for Health Law and Policy Innovation of Harvard Law School. Katie co-leads the center's whole person care initiatives, which explore the legal and policy implications of addressing social determinants of health through the healthcare system. In her work on these initiatives, she has had the opportunity to work with community-based organizations, state agencies, healthcare providers, and coalitions to develop strategies to increase access to innovative nutrition, housing, transportation, and navigation services. Prior to joining the center, Katie was an associate at Ropes & Gray. She is a licensed member of the Massachusetts Bar. So with that, I will turn it over to our first speaker, Kimberly. Thanks so much.
Thank you. So hello, everyone. My name is Kim Libman. My presentation today is going to focus on using evaluation and communication tools to enhance program and organizational sustainability. Next slide. For any of you who are new to my organization, ChangeLab Solutions works across the nation to advance equitable laws and policies that ensure healthy lives for all. We prioritize communities whose residents are at highest risk for poor health, and we're an interdisciplinary team of lawyers, planners, public health analysts, and more who work with neighborhoods, cities, states, and tribes across the country to create thriving, healthy communities. Next slide. Before we begin, I want to just give a quick disclaimer about our work. This presentation is for informational purposes only and should not be considered legal advice. Next slide. So here's a quick overview of my presentation. In my experience working on food systems and policy issues over the past decade, I've learned that there are a couple of complementary skills that can help ensure the sustainability of a program or organization. These are evaluation and communication. So these skills kind of bookend the bread and butter, so to speak, of your work on food insecurity, and measuring and communicating success are essential tools for maintaining your relationships with funders or using policy to help institutionalize change. To start, I'm going to take a moment to address some considerations for communicating with your funders during COVID-19 crisis. Then I'll provide a short recap of the evaluation webinar that preceded this conversation in the Root Cause series. And then finally, I'll go over some considerations and tools for using measurement and communication to help ensure the sustainability of your work. Next slide. Okay, so the coronavirus pandemic is changing the content and context for our work. Addressing these shifts strategically can help ensure your organization makes it through this financially challenging time. If you haven't already, you should be proactively reaching out to your funders and initiating a conversation about flexibility now and flexibility in the future. And of course, I suggest that you address these things, you address these three things in your outreach to funders. So number one is flexibility in service or program delivery. So questions you might ask are, can or should you pivot work to address the intersections of food insecurity with the pandemic and its economic impacts? You might also want to ask if there's flexibility in the timing of your deliverables to accommodate the shifting needs of partners on the ground or perhaps shifting staff capacity. Another kind of flexibility you might want to find out if it's available from your funders is flexibility in your current use of funding. So can you move what are sometimes referred to as quote unquote program dollars into general operating support so that you just have more flexibility and liquidity in how you're covering your core expenses? You might want to also ask about potential changes in future funding or renewal processes. I know for our organization, some funders that we've spoken with, especially health systems, know already that they won't have funds available to renew contracts next year. Some philanthropic organizations may be shifting their funding priorities and also the levels of funding that they have to offer. They also have emergency funds available in the short term to help grantees that are really in a pinch. So knowing about these options can help you navigate the next 6 to 12 months more strategically. And I want to also just flag that, of course, you should consider who typically holds and manages your organization's funder relationships as you plan and conduct this kind of outreach. Next slide. So because I'm going to talk about evaluation in the context of program sustainability, I want to just take a moment to reflect and pivot off what was shared in the previous webinar. That webinar shared an overview of evidence linking food insecurity and health. It highlighted some gaps in knowledge about interventions in that space. It gave you some examples of health system interventions, including food insecurity screening and food as medicine. And then there was kind of a deep dive on some data considerations around electronic health records and billing. So the information I'm going to share today is a little bit more granular and provides a quick and basic how-to in terms of measuring your own success or working with an evaluation consultant so that you feel better informed and empowered to help shape that design and measurement activity. Next slide. So this is where I'm hoping that we can have like a slight interactive moment. If you want to, feel free to use the chat function to just type in any reflections you have about your experiences with evaluation. So when I do workshops on evaluation, I often start with these questions. So what comes to mind when you hear the words research and evaluation? What experiences have you had with these ideas and practices? I start there because I find that especially in communities that are over or under researched, so for example, these could be Black communities, Indigenous communities, low income communities, or LGBTQIA communities, people have shared frustration and mistrust of the evaluation and research processes and of researchers. So if you work with these groups, you should bear this in mind if you consider asking people to share their ideas, experiences, or especially their personal health data. One strategy for addressing this challenge is that you may want to invite members of the communities you serve to participate as co-researchers or paid advisors to your evaluation. Next slide. So there are lots of good reasons to evaluate your work on food insecurity. The last 3 points on this list speak directly to the theme of program sustainability. So I'm going to skip ahead to those. Communicating program goals and accomplishments to stakeholders. This will help keep those folks engaged with your work and will help them remember that you're out there, know what you're doing, and understand the key strengths and your impact. The next one, to meet the requirements of a grant or justify the renewal or the extension of your funding. This one is pretty clear. It'll help you maintain the financial support you need to do your work. And then finally, to argue for scaling up a pilot project or to create a policy that formalizes a project or program. So again, Change Lab, we do a lot of work on policy development. And I want to flag that even though it's not the core focus of my presentation today, taking what you do and turning it into a policy is one way to institutionalize change and ensure that your work has a lasting and broad impact. Scaling those policies, so moving perhaps from an institutional policy or a very local policy or a policy in one setting to policy in other settings, is another way of doing that. And of course, having strong evaluation data is really key for the advocacy work that'll have to happen to make that a reality. Next slide. So this is where I want to get a little bit granular and give you some tools for thinking about and talking about evaluation, either doing it yourself or talking to consultants or evaluation staff at your institution. So there are different types of evaluation that you can conduct depending on what it is that you're hoping to measure or learn. Evaluations can also be participatory or done by an outside consultant. There are lots of pros and cons to each approach, and I'm happy to discuss this in the Q&A. Across all types of evaluation, you should work to capture community knowledge, stories, and lived experience. These are key ingredients when communicating the what, why, and how of your success with funders and policymakers. So just to give you a little bit more detail, you could use a formative evaluation to help identify how a new program is working or can be improved. You can use a process evaluation to understand if an intervention that you're delivering is true to its design or is being executed with fidelity to its initial intent. And then I think what we typically think of when we think of evaluation is outcomes and impact evaluation, where we try and understand the short and long-term changes created by our work. Next slide. So these next two slides provide a quick overview of some of the methods for collecting data or measuring your success and the indicators of success that are specifically relevant to work on food systems. The methods you use should be selected based on the questions you're trying to answer, not based on what kind of data is easiest to get, most available, or in some cases, the most engaging to collect. So qualitative data, this is interviews, focus groups, case studies, sometimes reviewing like records or documents, or just, sitting down and taking notes and observing what's going on in a given setting. Quantitative data includes things like surveys, clinical records, pre and post tests. You can also do document review in that way, and you can observe things that you count. And then I always like to include geographic data because I think it's important to understand some of the spatial and settings-based dimensions of our work. And so for this, you may include mapping, or keeping track of like the routes or journeys that people take between different settings. Next slide. So here are some categories of indicators or measures that you might consider gathering and examples for each. A change in food security would be a change in a type of health indicator. If your program operates a food pantry or works with retail outlets, you may also want to consider utilizing existing data about the types and volumes of food distributed through these channels, in addition to information about the people you serve and the impact of that food on their lives and well-being. I won't read through this entire list, but the idea is that it gives you again, just some inspiration, some things to start working with in terms of thinking about what in many cases are kind of like low-hanging fruit of things that you could measure and information that you can capture about your work that can easily be used to inform what I'm going to talk about next, which are crafting clear stories about the work that you do. Next slide. So there are many factors to consider when designing an evaluation. Here are a few more questions you may want to reflect on as you design your measurement strategy. So of course, any evaluation that you conduct is going to be influenced by the resources that are available. You should always think about the data that you already have. You want to consider who your audience is. Is it a funder? Is it a policymaker? Is it meant to inform your internal practice? And how does that audience think about success? Next slide, please. So before I wrap up, I just want to share one tool that I have found useful in helping to craft strategic communications about success that can be really effective with funders, policymakers, and other stakeholders. Next slide. So learning stories are stories that share our work in a way that helps to inspire action. So these quote unquote clear learning stories, this is a tool that was developed based on the principles of solutions journalism. These stories utilize data and help frame the narrative in a way that aims to spread action and innovation. So CLEAR is an acronym and a story template. I'm going to walk you through the acronym, and then I'll just quickly go through one example. So the C is for collaboration. You typically want to start your story by describing who was involved. L is for learning. Next, you would want to describe the core challenges that were addressed, the successes achieved, and highlight any lessons that were learned. E is for equity. Here you want to describe the change made and who benefited. This is, I just want to flag, is like a particular space where outcomes data maybe fits in. Action, you want to include a call to action, and this would be a space where you could elevate a best practice. And then finally, replication. So how might the work that you're highlighting in your story inform change in other contexts, and where could the lessons or tools be applied next? Next slide, please. So here I'll just quickly walk you through one example. This is a letter to families with children in a Head Start program that is implementing a new food policy that seeks to influence the broader culture and community norms. In addition to changing the types of food served in the program, the policy asks families to choose healthy options for celebrating birthdays in school and prohibits families from sending prepared foods to the program. Next slide. So to walk you through, again, just a clear format, under collaboration, the who here would be the Head Start program, the tribal council that authorized the policy, the families that are engaged in making that change, and then also perhaps the food vendors that are doing new procurement to meet the nutrition standards and food standards that are part of the policy. The learning, you'd want to describe some of the challenges and successes around establishing healthy eating patterns across settings. So thinking about the Head Start setting as well as the home setting. And then equity. So here the changes would be in the nutrition and food served to children in the Head Start and also potentially at home. And then action. You want to use the policy to sustain change and to engage families in shifting those community norms. And finally, replication. So in this case, the replication could be at other institutions. So since this is a Head Start policy, a story could highlight the opportunity for implementing the same policy, let's say in an elementary, middle, or high school, or for replicating this policy again in other tribal communities or other localities in that region. Next slide. So I want to thank you for listening. Here's my email address if you'd like to get in touch. I'm going to now turn the webinar over to Katie Garfield from the Center for Health Law and Policy Innovation at Harvard.
Hello, and thank you so much to the Root Cause Coalition and to Monique and to Alex for having me here today. As was mentioned at the start of the webinar, my name is Katie Garfield, and I'm an attorney and a clinical instructor at Harvard Law School's Center for Health Law and Policy Innovation, or CHLPI. At the center, my work really focuses on helping community-based organizations to develop and sustain innovative programs that address social determinants of health and health-related social needs in the healthcare space. So this means that a lot of my work really focuses on these questions of funding and sustainability, and more specifically, the question of how do organizations shift from reliance on short-term funding sources like grants to longer-term, more sustainable funding streams that could be available through our food or healthcare systems. And that's really where my presentation is going to focus today. Kim has just done a wonderful job of really describing how you can develop a story about the value of your intervention and then map out a sort of a conversation with a potential funder or policymaker. So now we're going to shift gears a little bit to think about who you might be having that conversation with, given current opportunities, particularly in the healthcare space. So next slide. But before I really jump into that, I, like Kim, do want to step back and recognize that we are not operating under normal circumstances right now. Right now, a lot of you and your organizations are probably thinking about sustainability really in two ways and on two timelines. So first, how do I sustain my organization sort of right now in this moment of unprecedented crisis? And then second, when we hopefully get past this crisis, how do I set up my organization or my intervention or service for success in the long term? So as you can see from this brief agenda, I'm just going to sort of go in that order. First, talking about sustainability right now. So sustainability in the COVID-19 context. And then I'm going to step back and sort of look beyond the immediate moment to dig into longer term funding streams. And then finally, I'll end with some initial next steps that you might take as you begin to explore some of the opportunities I've described today. Next slide. So first, let's take a look at what it means to sustain a nutrition program in this highly, highly unusual moment. We know from speaking to so many organizations that nutrition programs are under incredible strain right now. Unemployment rates are soaring, leading to widespread food insecurity. I've seen a number of estimates really ranging anywhere from about 20 to 38% of food insecurity across the nation in this moment. To put that in perspective, that's up from about a 12% food insecurity rate in 2017. So we're seeing a doubling or even tripling of the need for nutrition services. At the same time, in order to keep workers and clients safe, I know that nutrition organizations are being asked to overhaul their operations almost overnight, switching to new staffing, delivery, and preparation models. And all of this, the increased demand, the immediate changes, all of this creates a need for immediate funding to support programs as you sort of scramble to respond to this crisis. And so what I'd first like to talk about is, where is that funding potentially coming from? What can you be looking to? Well, we know, of course, that a lot of private funders are doing their best to support nutrition programs through things like grants and donations, and some of the shifts in the way that they're approaching their funding, as Kim described earlier. But by and large, a lot of response is then coming from the state and federal levels of government. In particular, we know the federal government has passed a number of stimulus bills that provide support to nutrition programs. Several of those bills are highlighted here. So we've got the Families First Act, the CARES Act, and the most recent Paycheck Protection Program and Healthcare Enhancement Act. Next slide. So many of you are probably already very familiar with the details of these stimulus bills, but I did just want to take a second to sort of walk through the big categories of opportunities they present if you are looking to have to respond in this moment. So in general, I see these opportunities as falling into sort of three main categories. One, loan programs for specific individual nonprofits and businesses. Second, additional funding being provided to core safety net programs. And third, some tax benefits that may influence donations. So in speaking to many nonprofit nutrition organizations, the opportunity that's probably most important and probably most on your minds is, of course, the Paycheck Protection Program. And next slide. There we go. Oh, sorry, not totally next slide. I was just getting the arrow back. Small businesses and nonprofits can apply to this program through participating lenders. If approved, you can take out a loan equal to 2.5 times your average monthly payroll costs, up to a total of $10 million. And the really important program, and the reason why so many people are focused on this loan program in particular, is the fact that much of the loans that are being given through this program can be forgiven if the applicant uses them to cover certain costs and meet certain requirements. And because of this, as you've probably heard, the program is incredibly popular and ran out of its initial $349 billion in a few weeks. However, the most recent stimulus package, the PPP Enhancement Act, has since provided additional money in this program to allow it to serve more organizations. So it is, again, an opportunity. And then beyond this Paycheck Protection Program, there are some other opportunities to be aware of in the stimulus packages. For example, there's the Economic Injury Disaster Loan Program, which is another loan program that provides loans up to about $2 million. Notably, though, that one is not eligible for forgiveness. Additionally, the CARES Act and the Families First Act both provide significant boosts in funding for core food safety net programs. So these are things like SNAP, WIC, elderly meals programs funded by the Older Americans Act, and the support given to networks of food banks and food pantries through programs like the Emergency Food Assistance Program, or TFAP. These additional funds are generally flowing from the federal government to the states for distribution. And so if you participate in any of these programs, so for example, if you're a Meals on Wheels provider, you may want to reach out to the relevant state agency that's governing those programs in your state to figure out how they're distributing those supports. And then finally, as you see on the chart here, there are also some philanthropic opportunities emerging from the stimulus bills. In particular, the stimulus bills raised the caps on tax-deductible donations for individuals and corporations for 2020. As a result, there is an increased incentive for individuals and institutions to donate to your cause. But really, this slide is just giving you the tip of the iceberg. I know that many state and local governments are also providing funding through their budgets or through sort of the gathering of philanthropic efforts to support COVID response. So to learn more about those opportunities, I would encourage you to explore state and local government websites, see if your state or municipality has a COVID response task force that may be working on some of these issues, or explore the websites of some of the food and health advocacy groups in your area who are likely very abreast of these new opportunities to support food and nutrition services. Next slide. So that should give you a very high-level overview of current opportunities to address immediate funding needs due to COVID. However, I know that you're also likely trying to think beyond this immediate crisis to shore up long-term funding and sustainability. This slide provides an overview of the large range of funding streams that exist to support nutrition interventions beyond this immediate crisis. So historically, the United States has addressed food insecurity through the programs that are sort of on the outer edges of this slide. It has increased the ability of low-income individuals to afford food through programs like SNAP and WIC. And at the same time, it has provided some direct support to food banks, food pantries, and meal programs through things like the Older Americans Act and TFAP. In contrast, nutrition services that don't fit neatly into these broader programs, so these are, I know you heard about food as medicine programs in previous presentations. So those services like produce prescriptions, medically tailored meals, medically tailored food boxes, they haven't fit as neatly into some of those food system programs, and as a result, they've often relied on philanthropy and government grants. So these shorter term funding streams that appear on the left-hand side of this slide. And so as you know, we're now seeing a shift in this pattern. As research continues to emphasize the critical role that nutrition plays in health outcomes, we're seeing new opportunities to support nutrition interventions more sustainably using healthcare dollars. And these opportunities really exist in all of the healthcare funding streams that are listed on this slide. Everything from Medicaid, Medicare, and employer health plans to hospital community benefit programs and programs that are specifically serving individuals who are dually eligible for both Medicaid and Medicare. Given our limited time today, I'm going to focus in on opportunities within the two programs that are probably most important to food insecure populations, Medicare and Medicaid. And let me just note here also that I know there's a lot of conversation going on in this space about the tension between funding things in the healthcare system versus the food system. We're focusing on the healthcare system today because that's where we see a lot of concrete opportunities emerging, but let me provide the caveat that I absolutely believe that it is so important to continue to robustly fund our food system opportunities and think about ways that some of these interventions could also fit in there. So our focus today is going to be healthcare systems, but again, the food system opportunities being so important and needing continued attention as we move forward. Next slide. So to begin, let's take a look at Medicare. And I apologize as I'm really going to be starting at the very beginning here. So for those of you for whom this is review, I apologize, bear with me. So Medicare is, of course, our nation's public health insurance program for individuals 65 and older, certain individuals with disabilities, and individuals living with end-stage renal disease or ALS. Medicare enrollees typically receive their coverage in one of two ways, either through original Medicare or Medicare Advantage. So original Medicare is really that standard form of Medicare in which enrollees receive Medicare Part A and B benefits, so that's hospital insurance benefits and medical or sort of outpatient insurance benefits directly from the federal government. About 2/3 of Medicare beneficiaries fall into this category, this original Medicare. Unfortunately, as far as we've been able to certain, there's not really any solid coverage of food in original Medicare. So there's not a lot of opportunities for this 2/3 of Medicare enrollees that participate in the sort of standard version of Medicare, though there is some coverage of ancillary services like nutrition counseling. In contrast, the other 1/3 of Medicare beneficiaries are enrolled in Medicare Advantage plans. So these are plans where private insurers, so insurers like Humana or Aetna or Blue Cross Blue Shield, those private insurers administer Medicare benefits. So while these Medicare Advantage plans must generally cover all the benefits that would be covered in original Medicare, they also have some flexibility to go beyond that, providing what's called supplemental benefits. And these supplemental benefits are really the primary opportunity to pay for food within Medicare right now. So to address nutrition needs that have a healthcare impact for Medicare enrollees. So next slide. And so let's dig a little bit more into that. Medicare Advantage plans have historically had only limited ability to cover food as a supplemental benefit. So for example, they were able to cover meals, but for really short duration and under narrow circumstances. More recently, though, we've seen policy changes that are expanding upon that opportunity. The biggest policy change that we've seen on this is captured on this slide, and that's special supplemental benefits for the chronically ill. Beginning this year, so 2020, Medicare Advantage plans have significantly more flexibility to cover food as a supplemental benefit under this special supplemental benefits for the chronically ill or SSBCI category. Under this new category of supplemental benefits, Medicare Advantage plans can cover additional supplemental benefits for chronically ill individuals. And that's specifically defined in this program. So this program considers individuals to be chronically ill if they have one or more comorbid or medically complex chronic conditions, are at high risk of hospitalization or other adverse health outcomes, and require intensive care coordination. And just so you know, looking at the Medicare population, there are a huge percentage of the Medicare population that is living with complex chronic conditions. And so while this sounds very specific, there is a lot of latitude here to reach a wide variety of patients that might have nutritional needs that are related to their health outcomes. And CMS has explicitly stated that Medicare Advantage plans may cover an array of food and nutrition services as SSBCI, provided they have a reasonable expectation of improving or maintaining the health or overall function of the chronically ill enrollee. So in the last presentation that you heard about research, you probably heard a lot about those connections, the way that things like medically tailored meals and produce prescriptions can have a real impact on health outcomes, and so they would really fit within this category. The SSBCI program only went into effect for 2020 plans, so they've just started. So we don't really have a great picture yet of how many plans are taking advantage of this new opportunity or what they're covering. However, given the escalating food insecurity rates and the particular susceptibility of elderly individuals with diet-related chronic conditions to COVID, we may see more plans seizing this opportunity moving forward. And just as context, the bids for next year's plan, so 2021, are actually due this upcoming June. So this is a process that's really happening right now. Next slide. And then finally, I also want to touch on some of the opportunities in the Medicaid program. Medicaid is, of course, our nation's safety net health insurance program for low-income individuals. Unlike Medicare, Medicaid is run as a federal state partnership. So that means that each state is designing and operating its own program within a broader federal framework. As part of that framework, federal laws and regulations establish a series of mandatory benefits that states must cover and optional benefits that states may cover. While I personally would argue that some of these categories are broad enough to allow for coverage of some food interventions, CMS has historically not agreed with that position. And so as a result, nutrition interventions are generally not covered in standard Medicaid programs. However, like Medicare, Medicaid does allow for some flexibility on this point that has recently created some opportunities to fund nutrition services, really, again, targeting improving health outcomes within this population. For example, roughly 70% of Medicaid beneficiaries currently receive some portion of their Medicaid benefits from a Medicaid managed care organization. So that's a health plan very similar to a Medicare Advantage plan, but serving Medicaid. So like Medicare Advantage, these MCOs must generally cover all benefits covered by that state's Medicaid program. But they also have a flexibility to go beyond that level of benefits and provide some additional benefits under categories such as in lieu of services, value-added services, or administrative services. As a result, a number of MCOs have covered nutrition interventions under these flexibilities, making them a key opportunity. So a good example here is an MCO called Health Partners Plans in Pennsylvania that has worked with a local medically tailored meal provider to provide medically tailored meals to certain patient populations that it serves. Beyond these flexibilities, states may also seek CMS approval for waivers or state plan amendments that allow coverage of nutrition services. So a good example here is that CMS has historically allowed states to cover meals under home and community-based services waivers. These are waivers that are intended to keep high-need individuals in their homes rather than in nursing homes or other institutional settings. So you can imagine how providing meals and nutrition services to those individuals can be really helpful in keeping them in their homes and communities. Additionally, CMS has also allowed a number of states to use what are called Section 1115 demonstration waivers to cover nutrition interventions. So next slide. And I'm going to go a little bit deeper here because this is really sort of the broadest opportunity, able to reach sort of the widest range of services. It's also where we've seen some interesting movement more recently. So Section 1115 demonstration waivers are really the most flexible type of Medicaid waiver. And under these Section 1115 waivers, the Secretary of Health and Human Services has the discretion to approve waivers of many core Medicaid requirements, and to provide federal funds to pay for services and populations that would not otherwise be covered under the Medicaid rules. Because of that flexibility for these 1115 waivers, several states have now received approval to use Section 1115 waivers to cover some nutrition interventions. So two good recent examples here are North Carolina and Massachusetts. So for example, in October 2018, North Carolina received approval for an 1115 waiver that will establish a $650 million Healthy Opportunities Pilots project. These pilots are going to evaluate the impact of providing evidence-based interventions to address social determinants such as food insecurity. And then similarly, in 2016, my home state of Massachusetts received approval for an 1115 waiver that establishes the Mass Health Flexible Services Program. This program provides a stream of funding for the state's Medicaid accountable care organizations to address housing and nutrition insecurity in their patient populations. In particular, on the nutrition front, these ACOs may use this stream of funding to cover goods, transportation, and services that educate members about appropriate nutrition and help members access food needed to meet their nutritional needs. And here you see some examples of the types of things that could be covered there. So foods that meet nutrition and dietary needs, home delivered meals, transportation to meet nutrition needs, and nutrition education and skills development. Implementation of this program has taken a little while, and it has really just gotten off the ground in January 2020, with a number of ACOs covering services in the nutrition space, things like medically tailored meals, produce prescriptions, and some broader interventions as well, especially in light of COVID and the need for an immediate response. Next slide. So that gives you a sense of what is the landscape in which we're working in right now. Where are some of the key opportunities that are emerging in the healthcare space? Where can you be looking as you think about trying to shift perhaps from shorter term funding sources like grants and either from the government or philanthropy to longer term funding streams like Medicaid or Medicare. Or as I said, we don't want to neglect the fact that there hopefully will continue to be some opportunities emerging in the food system as well to cover some of these more innovative services. And this final slide is really meant to provide some strategies and next steps, especially if your organization is sort of just starting out in this shift away from short-term funding and interested in pursuing some of these longer-term opportunities. So many of these opportunities are probably obvious, but I think they bear repeating. So first, I would say get connected. Where possible, lean on your broader community to do some of the heavy lifting for you, especially where there are organizations already doing this. So by joining relevant listservs and local coalitions, you can really leverage the expertise of other organizations working in this space to stay abreast of new opportunities or policy changes that could create opportunities for sustainability for your organization. Second, also think about how you can do your own local legwork. As I mentioned, some of the biggest opportunities right now in the healthcare space are within Medicare and Medicaid plans. So Medicare Advantage plans, Medicaid MCOs. So get to know which Medicare Advantage plans and Medicaid MCOs are actually operating in your service area. And when you feel ready, you can reach out to them with some of the evaluation pieces and data that you're gathering that Kim mentioned to start exploring the ways that you could partner with them to improve the health of their patient populations. And then finally, explore whether bigger opportunities may be available or possible in the future based on the policies in your state. For example, you can explore cms.gov and your state's Medicaid website to learn about what waivers they currently have or which ones they're applying for that might be able to include nutrition services. So next slide. So that's really all I wanted to cover today, really just encouraging you to think about as you get past this moment of crisis, what are the longer term opportunities and how you can begin to explore them. And I think now we're open for Q&A.
Super. Thank you so much, Kim and Katie. That was great and really insightful and a wonderful last food insecurity webinar for the Learning Cohort series. We did have one question come into the chat box so far, and just a reminder to everybody on the phone, if you have a question, you will stay muted, but please just add it to the question box, and the moderators of the session can see your questions and we can field them to the presenters. So the first question that came in is kind of a big question, but it does say, what do you believe are the most successful methods of both data collection and evaluation? What unique insights can they provide?
Sorry, can you reread the question again? I feel like there were a few pieces to it.
Sure, no problem. It says, what do you believe are the most successful methods of data collection and evaluation? What unique insights can they provide? And I know it's a rather lofty question. So if you want to take a whack at it, feel free to slice it however is relevant for you all.
Yeah, I have like a few immediate thoughts. It is a really big question. Thank you. So I would say in terms of like successful methods, my like training in research really emphasized qualitative data. And I have found that a few things. I found that like really getting deep with people about where they go to buy their food or get their food, if they're getting it from a pantry or someplace where they're not buying it in the traditional sense, or talking to people about what it is that they choose to eat and why, can provide some really interesting insights into all the ways that our relationships with like food, our bodies, and health are actually really complex. And so I think there's some like great insights that can come out of that kind of engagement, and that often are like go against the grain of what we typically see in research. So like, you know, just as like a light touch example, there has been lots and lots of research about the need to like, you know, have supermarkets in places that we used to call food deserts or food swamps. But I found that, you know, when I talk to people about their experiences with food, there are some folks for whom the inconvenience of not having a supermarket nearby or a food pantry nearby is a determinant of what they eat. But for a lot of folks who are really into what they eat and motivated by the connections between food and health, or just by the pleasures of food, they'll go really far out of their way to get what they want, even if it means going to several food pantries. So just to say that I think that like talking to people and really listening is one way to go. And then also I think like data that is not narrative. So like working with existing data around like what gets procured, what's moving off the shelves in a food pantry, or like what are the redemption rates for your fruit and vegetable prescription coupons. I think sometimes that like very hard data can be insightful as well, because it's not as easily swayed by human experience.
Super. Thank you so much. That was great. There was another question that came into the chat box. It's a little more specific. Do you know of any produce prescription that is being covered by insurance?
Hi, this is Katie Garfield. So yes, we do know that there are some inroads being made on the produce prescription front. I do believe that there are some programs that are connected to Medicaid MCOs. I'm not as sure if there are any in the Medicare Advantage space yet, but there's a lot of great contacts out there to find out more information. Groups like Wholesome Wave and DC Greens are sort of great leaders in this space that would be able to give you more specifics. But yes, I do think there is progress being made, particularly on the Medicaid MCO side there. Though a number of those programs are also being currently funded through state or local grants, and also through an opportunity that came out of the Farm Bill which is the new produce prescription pilot program that is built into the GovSNP program in the Farm Bill, has provided some grants for produce prescriptions very specifically. But yes, in the more medical space, we are seeing funding coming from Medicaid MCOs in some instances, and then also from healthcare institutions that are really interested and invested in that particular intervention.
Wonderful. Thanks so much. I know the produce prescription piece has been an ever increasing piece of the model to address food insecurity, and being located in Washington, D.C., like you say, DC Greens has been kind of front and center in that piece as well. So that they're a great organization to tap into their expertise and knowledge as well.
I would also, just briefly highlight that in that 1115 waiver that I mentioned in North Carolina that is sort of getting up and running, one of the interventions that they are thinking about there is also produce prescription. So that's a broader opportunity in their Medicaid system that could include that intervention.
Great, thanks. So I think that's it for our questions today. Just a reminder to everybody on the line to please visit the Forum B site. If you have any additional thoughts, perspectives, resources you want to share, you can link there as well. So everybody who attended today can see any resources that might be helpful and related to this conversation. And I just want to thank everybody again for being a part of the Learning Cohort series. It was really wonderful to be able to address all these different topics and work with root cause on both the issues of housing insecurity and food insecurity. So if anybody's interested, we have our last housing insecurity webinar this Thursday at 1 p.m. Otherwise, always reach out if you have any thoughts or comments, and visit the Forum B site. So thank you everyone for attending, and a big thank you to our speakers today.
Thank you.
Thanks.
Thank
Bye,
you.
everybody.